Diabetes mellitus is a metabolic disorder characterized by hyperglycemia, that is, increased blood sugar level and other signs and symptoms. Normally, an hormone is produced by the beta cell in the islet of Langerhans of the pancreas called the insulin. This insulin helps to control and regulate the blood sugar. It acts as a key that unlocks and opens the cell for glucose to be able to be absorbed into the cell to generate energy. Anytime you eat carbohydrate diet, it will be digested and turned into glucose. This high level of glucose in the blood from the diet that you've eaten will stimulate the beta cell in the islet of Langerhans of the pancreas to produce sufficient insulin, which will travel through the blood to the target cell and now serves as a key to unlock those cells and tissue for glucose to be able to enter them to generate energy. But any factor that can impair the insulin production or that can cause resistance to insulin by the cell will give rise to accumulation of glucose in the blood called hyperglycemia. Hello viewers, welcome back to my channel, Ask Your Nurse. If this is the first time you've seen my video, I'm Ashamolu Washion. I'm a registered nurse. This channel focuses on content related to health. Thanks for stopping by and do well to subscribe to my channel. Hit the notification bell below to be the first person to know anytime I upload another new video. And to my returning subscribers, thank you guys for all you do. Since the glucose from the meal you have taken is not absorbed by the cells and tissue, these cells will be hungry, which now send a signal to the brain to stimulate the appetite center in the brain to make you feel hungry, and you continue to eat excessively, which is called polyphagia. And because of high glucose level, the kidney can filter all the glucose in the blood. If it is higher than 180 milligram per dl or 10 millimole per liter, so the remaining glucose pulls water with itself to the urine in an attempt to flush out the excess glucose, leading to polyuria and glucosuria, that is frequent urination and glucose in the urine. As a result of frequent urination, it leads to dehydration, which will give rise to excessive thirst, which will make you to drink more water, and it is called polydipsia. Because the sugar or the glucose cannot get into the cells and the tissue, these cells and tissue are starved and deprived of energy. So the body will find alternative means of generating energy by burning the fat and the muscle, leading to unexplained and unintentional weight loss. Other signs and symptoms, apart from the signs I've mentioned above, that is the polyphagia, polyuria, polydipsia, and weight loss, include fatigue or weakness because the cells are not getting enough glucose for energy. Blood vision, increased blood sugar level causes movement of fluid into the eye lens, thereby making it to swell up and unable to focus well, leading to blood vision. Also, hyperglycemia destroys the retina of the eyes, causing retinopathy. The high blood sugar increases the risk of glaucoma. Slow or delayed wound healing because of impaired blood circulation to the affected cell or tissue and impaired immunity. Frequent or recurrent infections like skin infection, UTI, yeast infection because of reduced immune response from hyperglycemia, and also this bacteria and virus feed on the glucose and promote their growth. Numbness and tingling sensation in the extremities like the hand and the feet because of impaired blood circulation and nerve damage. There is dry mouth, dry skin, skin changes, irritability, and mood swing. Ketone breath, or you have a fruity smell breath, especially in type 1 diabetes or advanced type 2 diabetes, where there is no insulin at all and the body looks for alternative means of generating energy by burning the fat to generate energy. Now let us go to the causes of diabetes mellitus. Number one is autoimmune destruction of the pancreas, where the body fights itself to destroy the beta cells in the pancreas that produces insulin, and may be triggered by genetic factor or viral infection. This usually occurs in type 1 diabetes, which results in absolute insulin deficiency. Since there is no insulin at all because of the destruction. Insulin resistance by the body cells, that is, there's production of sufficient sufficient insulin, but the body is not absorbing it. The cells are not opening up to absorb this insulin. Progressive decline in insulin production due to constant demand. Accident or trauma to the pancreas. Pancreatic disease like pancreatitis. Endocrine disorder like Cushing syndrome. Medications like steroid or antipsychotic drugs. Infections like congenital rubella. And pregnancy as a result of hormonal changes during pregnancy. There are also various predisposing factors to diabetes mellitus like obesity, especially around the abdomen, physical inactivity, genetic predisposition. That is, if your parents have diabetes, you have 50% chance of having diabetes. Unhealthy diet like too much carbohydrate intake, and age. The cells and tissue becomes less responsive to insulin as one advances in age. You become less active and pancreas may produce less insulin. If diabetes mellitus is left untreated, it can lead to serious and irreversible complications like amputation from diabetic foot syndrome, neuropathy, that is nerve damage, blindness, atherosclerosis, stroke, and even renal failure. Diabetes mellitus is a leading cause of renal failure now. I want you to note that you can have diabetes mellitus without you knowing. So you should ensure you talk to your healthcare professional to check you up for diabetes mellitus by checking your blood glucose level. And if you are diagnosed of having diabetes mellitus, ensure you start treatment immediately to prevent irreversible and deadly complications from diabetes mellitus. We have come to the end of today's video. Thank you for watching to the end, and I hope you have gained something. If you have, you can also help me by subscribing to my channel, like the video, share with your friend, turn on the notification bell to be the first person to know the next time I upload another informative content like this. See you in my next video.